And I'm joined now by Dr. Milan Shah. He is I'm guessing, dermatologist expert who specializes in how to clear up your acne.
Absolutely. I practice aesthetic and laser medicine over at Beautologie, and we do deal with quite a bit of acne at our facility.
Now, this isn't just something that's relegated to teenagers, right? Even adults have problems.
Absolutely. It's not just an adolescent phenomenon. We see it very commonly with women in their 30s, 40s, 50s even sometimes. So there's a lot of different things we can do to help you out throughout the way.
What do you think are the most common misconceptions about what causes acne and how to clear it up?
Well, you know, it's always back to basics when it comes to skincare. And what really does cause acne is a multitude of different things. It's actually hormonal changes throughout your life, the environment that you're in. And you do want to address all these concerns, not just one. There's also a lot of different myths that we could talk about and disprove them and talk about the different types of studies that have been done in the past and go from there.
Okay. So what are some of the basic rules you should look at when you want to clear up your acne?
Well, you know, it's always tried and true. You want to find a good, gentle cleanser when you're working with acne. The cleansers out there on the market, the drugstore brands like Cetaphil, Eucerin are a great place to start. If you do have acne-prone skin, it's always a good idea to maybe incorporate a cleanser with something called alpha hydroxy acid. And that helps to clear off that dead skin, what we call keratin plugs that are the basic cause, the foundation of acne.
And I think one interesting point is not everything's going to work for everyone because everyone has a different skin type and maybe different causes.
Absolutely. In fact, benzoyl peroxides are a very common treatment modality for acne, and there is a fair group of people out there with an allergy to benzoyl peroxides, and in that case we do have to find a different remedy. There's dry skin types and sensitive skin types that are going to be more responsive to using things like creams and lotions rather than the more stringent types of skincare out there.
So a lot of trial and error in clearing up your acne.
Absolutely.
And what about some lifestyle changes you can make, not even cleansers specifically, but what things can you do in your daily routine to just help them clear up?
Well, we do know that diet high in carbohydrates, fat, and sugars actually do cause an increase in a hormone called IGF-1, and we do know there is a direct correlation to increased levels of this hormone and acne. So
chocolate really can.
Well, actually, that's the one myth that we've actually disproved with an acne with a study out there. They took a large group of patients, gave them a bunch of chocolate, and actually they haven't found a direct causal relationship between chocolate and acne. So you can indulge yourself in that. But some of the other things like sugars and carbs, keep them to a minimum.
And then another one that we had up there, another tip was shower after your workout so the sweat doesn't clog your pores.
Absolutely. You know, just showering or cleansing once a day is just not enough nowadays. We do recommend after your intense workouts, maybe showering and maybe using some of those over-the-counter benzoyl peroxides, the pads to clean off that excess sweat. And of course, an evening shower is always recommended as well.
Okay, and then about products. You can't buy into every infomercial you see. You cannot, you know, trust just because it's expensive maybe that it's going to work. Which ones do we want to look for? You mentioned a few earlier. Right.
The thing about infomercials and a lot of popular magazines out there, they do advertise a lot of products, and all too often you could actually get over-the-counter generic products which have the same ingredients, work just as good, and you're not paying an arm and a leg for. So, you know, just be wary about that. There are great products just at your local pharmacy.
When do you need to see a doctor? I think that's what we all need to know.
Absolutely. Well, you know, I always recommend trying the over-the-counter remedies for about 6 weeks. Give it a good 6 weeks and see if your acne is clearing up. And if it's not, and it's stable or getting worse, definitely a good time to see the doctor. If you have an allergy to the benzoyl peroxides or some of the over-the-counter medications, of course, see if the doctor can fine-tune that for you. And finally, if you have severe acne, what we call cystic or pustular acne, definitely, you know, you want to see your skincare specialist.
All right. Well, thank you so much for joining us this morning, Dr. Shah.
Thank you so much, Madeline. I appreciate it.
Of course. We'll be right back.